All right, let's get right into this explainer. Today, we're taking a seriously dense, complex medical topic and turning it into a high-stakes story about how your body's ultimate survival system actually works. We're diving into the fascinating world of adrenergic agonists. We're going to see exactly how medical science has figured out a way to hack the human fight-or-flight response, which literally gives us the power to pull patients back from the brink in emergency rooms every single day.
I mean, just think about that for a second. How is it even possible that one single chemical injected into the body can trigger such wildly different, life-saving reactions at the exact same time? You've got a substance that can jolt a failing heart back into a steady rhythm while simultaneously relaxing the tight, spasming airways of someone who is struggling to breathe. It really seems like magic, right? But it all comes down to a perfectly designed, highly specific biological communication system.
So to understand how this all works, we need to introduce what I like to call our master keys. In pharmacology, they call these sympathomimetics. Sounds like a mouthful, but these are basically just drugs carefully designed to mimic your body's natural neurotransmitters, specifically epinephrine and norepinephrine. By mimicking those natural chemicals, doctors can essentially hack into our sympathetic nervous system. They can literally turn the body's internal dials up or down to treat everything from a severe asthma attack to full-blown cardiac arrest.
Here is our game plan for today's explainer. Number 1, the adrenergic neuron factory. 2, alpha and beta receptors. 3, direct-acting adrenergic agonists. 4, dopamine and specific agonists. And finally, number 5, indirect and mixed agonists.
Section 1. The adrenergic neuron factory. The natural keys of the body. Let's step right into the microscopic factory in your nervous system where these natural master keys are actually manufactured.
Okay, everything kicks off inside the adrenergic neuron. Step 1 is synthesis. An amino acid called tyrosine gets transported into the neuron, gets converted to dopa, and then turns into dopamine. Step 2, this dopamine gets safely packed away into storage vesicles, and that's where it's finally converted into norepinephrine. Step 3 is the trigger. An electrical signal hits, causing a sudden rush of calcium into the cell, which forces those vesicles to just dump their norepinephrine into the synapse. Step 4, the neurotransmitter swims across the gap and binds to the target receptor, our lock. And finally, step 5 is the cleanup phase. The body rapidly removes the neurotransmitter. It mostly does this by sweeping it back up into the neuron for recycling, which we call reuptake, or by breaking it down using specific enzymes.
Get this, though. What's really fascinating here is the surprising ratio of what your adrenal gland actually pumps out. When your fight-or-flight system gets triggered, the adrenal medulla shoots a mixture of these natural keys straight into your blood, but it is not an even split. It's actually 80% epinephrine, which most of us just call adrenaline, and only 20% norepinephrine. That highly specific ratio, it's absolutely critical for prepping your entire body for sudden, intense action.
Section 2. Alpha and beta receptors, the physiological locks. We've got our natural keys, so now we need to look at what they actually open.
Think of this as your ultimate cheat sheet for the sympathetic nervous system. Notice the crucial contrasts between these receptors. Alpha-1 receptors, they are all about squeezing. They cause vasoconstriction in your skin and gut, which absolutely skyrockets your blood pressure. But look at beta-2. Beta-2 provides life-saving relaxation. It causes bronchodilation, throwing your lungs wide open so you can gulp in oxygen, and it dilates the blood vessels feeding your skeletal muscles so you can fight or run away. Meanwhile, beta-1 is mostly chilling in the heart, directly driving up your heart rate and pumping force. Understanding this map of locks is exactly how we answer that earlier question about treating the heart and lungs at the exact same time.
But, you can't run an engine in the red zone forever. It's an incredible survival mechanism. If a patient is exposed to these potent chemicals for too long, the receptors will actively defend themselves. They'll desensitize, physically hide by downregulating, or completely decouple from the proteins inside the cell. It's literally the body's way of pulling the plug to prevent the whole system from burning out.
Section 3. Direct-acting adrenergic agonists, drugs that hack the locks directly. This brings us to the actual drugs themselves. The perfectly forged master keys designed in a lab to bypass the factory entirely.
Picture a patient going into anaphylactic shock. Their blood pressure completely tanks and their airways rapidly swell shut. It is a terrifying, rapidly fatal cascade. In this exact setting, epinephrine is absolutely the drug of choice. Why? Because it doesn't just treat a single symptom, it flips the entire systemic switch. It's a high-stakes master key that unlocks multiple doors simultaneously to literally pull a patient back from the edge.
Let's rapid fire through exactly what a powerhouse shot of epinephrine does. It hits beta-1 receptors to massively increase cardiac output. It hits beta-2 receptors in the lungs for immediate bronchodilation. It hits the alpha receptors to clamp down blood vessels in the skin and gut, forcing all that essential blood straight to your core and muscles. And it even hijacks your metabolism. It triggers hyperglycemia by dumping glucose into your blood for instant energy and kicks off lipolysis to start breaking down fat. I mean, it is a total physiological takeover.
But here is a wild number for you. 2. That is the maximum duration, in minutes, that a dose of intravenous norepinephrine typically lasts in the body once the IV drip stops. These drugs are unbelievably potent, but their action is remarkably brief. And that's because your body is packed with specialized enzymes, specifically COMT and MAO, that act like a cleanup crew, rapidly hunting down and destroying these catecholamines the literal second they enter the bloodstream.
So, what if we want a drug to last longer? Well, chemists can just tweak the molecular structure to completely change how we use it clinically. Take asthma medications, for example. Albuterol is a highly selective beta-2 agonist. It's short-acting, designed to be a rapid rescue inhaler when an asthma attack suddenly strikes. But if we tweak that chemical structure just enough to avoid getting shredded by those enzymes we just talked about, we get salmeterol. This is a long-acting controller that keeps airways open for over 12 hours, which makes it perfect for preventing asthma attacks at night rather than rescuing them in the heat of the moment.
Section 4. Dopamine and specific agonists. Specialized tools for clinical emergencies. Moving on, let's look at a remarkably versatile drug.
Dopamine is basically the ultimate shapeshifter in the ICU. The lock it opens is completely dictated by the dosage the patient receives. Give a low dose, and it targets specific dopaminergic receptors to dilate blood vessels in the kidneys, helping to preserve renal function. Turn the dial to a medium dose, and suddenly it targets beta-1 receptors to help a failing heart pump harder. Crank it all the way up to a high dose, and it completely switches to alpha-1 receptors, causing massive vasoconstriction to drive up blood pressure and severe shock. One single drug, 3 completely different clinical effects.
Of course, there's no free lunch here. Hacking the body's ultimate survival system comes with a steep price. When we administer these drugs, we are essentially forcing the patient into extreme sympathetic overdrive. And the side effects definitely reflect that. Intense anxiety, fear, tremors, severe headaches. In the worst-case scenarios, pushing the heart too hard can trigger dangerous cardiac arrhythmias, or even cause fluid to back up into the lungs, which is known as pulmonary edema.
Okay, quick pivot. So far, we've only talked about drugs that act directly on the receptor locks. But what if a drug could massively stimulate your nervous system without ever actually touching the receptor itself?
Section 5. Indirect and mixed agonists, enhancing release and blocking reuptake. Meet the saboteurs. These guys manipulate the neuron's internal factory operations rather than acting on the lock itself.
Let's look at the indirect agents. Amphetamines basically force the neuron to dump its stored neurotransmitters directly into the synapse. Cocaine takes a different route. It blocks the reuptake transporter. That means the natural norepinephrine can't be cleared away, so it just piles up and violently overstimulates the receptors. And then there's tyramine, which is a byproduct naturally found in fermented foods like Chianti wine and aged cheese. Normally, your gut enzymes just break it down. But if a patient is taking certain antidepressants called MAO inhibitors, eating that aged cheese causes tyramine to flood the system. It displaces stored norepinephrine and triggers a dangerously high spike in blood pressure.
And why pick one strategy when you can use both, right? Mixed-action agonists, like epinephrine, launch a devastatingly effective two-pronged attack. They act directly by cracking the alpha and beta locks themselves, while simultaneously acting indirectly by kicking the neuron factory into overdrive, totally flooding the synapse with natural keys.
When we compare ephedrine to its exact chemical mirror image, pseudoephedrine, we see exactly how slight structural tweaks matter. Because neither of them are catecholamines, they don't get destroyed by gut enzymes. This gives them excellent oral absorption and a really long duration of action. Ephedrine easily crosses into the brain, causing central nervous system stimulation, keeping you alert and preventing sleep. Pseudoephedrine, on the other hand, has fewer of those CNS effects. It focuses its vasoconstricting power locally, making it a highly effective nasal decongestant.
But there's a real-world regulatory catch here. Because pseudoephedrine acts so effectively on this adrenergic system, and because it shares a molecular backbone that is very easily manipulated, it is heavily targeted for the illicit production of methamphetamine. And that is exactly why you'll find these effective cold medicines locked tightly behind pharmacy sales counters today.
So we've spent this entire explainer mashing the gas pedal on the human body. We've seen how mimicking a few chemical messengers can squeeze blood vessels, throw open airways, and literally restart a failing heart. But that leaves us with one massive, lingering question. If we can hack this system to put the body into extreme overdrive, how in the world do doctors force this exact same system to hit the brakes when the heart is working too hard? Well, that requires a completely different set of pharmacological hacks, the sympatholytics, and that is exactly what we are going to unpack in our next explainer.